ready to see. Is it possible? Can you open up our screen a little bit bigger? Can you see the wall that says International Implant Institute? Or do you just see a narrow screen?
On my end, let's see, because
keep going.
The recording is of one thing, and then
now we can you see the wall here, Brendan?
A little bit. It's a bit far away, but I can see it. Yeah.
Okay. Let's see. Is there any other way? There you go. Can you see it now?
Yeah.
You can, for sure. Okay. So we are here at International Implant Institute, which is located in Manassas, Virginia. My name is Dr. Julia Jackson. I'm an oral and maxillofacial surgeon. I am super glad that Brendan has invited us to be a part of his podcast this morning. The International Implant Institute consists of approximately 6 to 7 dentists from all over the world. This cohort study has one general dentist from Maryland, Dr. Umoran, and we also have a general dentist from Bristol, Virginia. In the past, we've had general dentists from California, Atlanta, Boston University, and also North Carolina. So people come from all over the states. We are very happy and pleased to also welcome folks from outside of United States of America. Dr. Cynthia, what's your last name?
Dr. Cynthia Wachuku.
Dr. Cynthia Wachuku is from Nigeria. Yes. Dr. Esther, and your last name?
Okuntala
is from Nigeria. We have Dr. Kola
Ibrahim Haroon from Nigeria.
And Dr. Praise
Okunola from Nigeria.
They have come from so far approximately 22-hour flights to get here. International Implant Institute has a entire 5-day course. Our focus is that we are going to teach general dentists how to place implants and how to restore implants. And in the rare occasion, if you cannot place the implant, then they need to be informed about how to socket graft. So the first few days of the course include Dr. Anarobi, who is a prosthodontist who works in Texas. He comes all the way over and he teaches his students how to utilize analogs, which would be to take impressions, how to show the impression material, the hard body and the soft body impression material. He teaches the students all the different parts and pieces for restoring implants. He goes over a plethora of information with his course and his lecture material. By the time the afternoon comes up, we also teach the students how to digitally take impressions. So we have a hands-on tutorial where they're doing intraoral scanning. Some of the students are the participants. Dr. Umoran was our patient this week. And we have a lab tech who teaches them how to use the iTero, and his name is Pedro. He also taught them how to do digital scanning with a photogeometry so that we can see the scans and eliminate the need for bite registration and Facebook transfers. Out with the old, in with the new with International Implant Institute. In addition, we have a CareStream representative who teaches the students how to utilize the CT cone beam scan and shows them how the patients step in, how the scan goes around their head, and how the images are transferred onto the computer and how you're able to communicate better with your patients about exactly what you're seeing and, more importantly, how to do pre-surgical planning for implant placement. Tuesday, we discussed bone graft, socket grafting. You can find me on Instagram at socket_grafting_girl. I always encourage people that if they're going to graft the sockets, they should be able to do step-by-step how to place bone graft material. Last but not least, on Wednesday, we do take the students down to Washington, D.C. We can't come from so far and not go to the Capitol, not have a chance to see the Washington Monument. I also saw the White House, and we stood in front of the Martin Luther King statue. We all stood our hands across just as poetically and justice as he did. We took a trip to the YM Dental Lab. And Esther, can you tell us a little bit about what you saw at the YM Dental Lab? Turn it just a little bit to you.
Hi, my name is Dr. Esther Okuntala from Nigeria. At the lab, it was very incredible because coming from Nigeria, we're coming from the Stone Age, and we're coming to see AI, seeing the 3D printers, we're seeing live scanning of the models into where they go to the computer and they are worked on and they are printed. The millers, we saw the A2 Pro, if I can remember correctly, the A2 Pro printers, and so much more that is beyond my scope of reasoning right now. Thank you.
So essentially, at the lab, we saw quite a number of new gadgets, and for us, it's a cutting-edge technology as regards impression making, the milling of the prostheses, new ideas, new technologies, and fabrication of custom abutments, implants, and the likes. So we saw quite a number of equipments out there in the laboratory yesterday. And, this is not just about seeing it in the textbooks or online. We were there live to see these new gadgets.
Very good. Thank you. On Thursday morning today, we have an entire morning and afternoon of So the students are come and prepared for taking ACLS, BLS, and PALS. Because as surgeons, you need to be prepared for any kind of event that may occur in your office. Fortunately, we have on faculty Cal's CPR. Cal is a medical professional who owns his own CPR company. And Cal is in California, at the ADA, which is the American Heart Association conference. And so he has brought in one of his instructors, whose name is Gaza. Gaza, please introduce yourself.
Good morning. My name is Ghazi. I'm a physician, overseas physician. I just recently moved to the state. I'm working with Innova Hospital. I'm doing with my best friend, Carl, some bar job. I'm covering him when he's traveling. Today we have amazing lecture with the guys. They're very cooperative. They're very well educated. And I hope the best for them.
Super. Thank you, guys.
Can you just shout out where you came from?
I'm from Middle East. I'm half Jordanian, half Saudi, but I did my medicine in Philippines.
Amazing. It's great to see where everyone came from. That's why I want to hear that you got to shout out where you came from too.
Absolutely. Praise, yesterday was Dr. Praise's birthday. So we're going to say happy birthday one more time. Praise, happy birthday.
Happy birthday.
We were down in DC. Yes, it was slightly raining, but Praise still brought a beautiful sunshiny smile on his birthday. In addition to learning the CPR, Praise has done an excellent job with how to properly do chest compressions. And we were going to show you how we are being taught this morning on chest compressions. The students receive direct tutorials utilizing mannequins and ambu bags. They are instructed on how to head tilt, chin lift, and how to properly resuscitate an adult during an emergency.
Okay, let's say that you are in your clinic taking care of one of your patients while the other patient's waiting in the waiting area. Is a 65 years old male, all of a sudden collapse. What you have to do as a physician, as a dentist, as a healthcare provider, there is no one around you. All what you have to do something to save this patient's life. So what you have to do, observe the scene.
Okay, first of all, I'll observe the scene, check for safety. Then I will check for if the patient is awake. I will tap the patient.
Perfect.
Then I would tap the patient. Then I'll check for the pulse.
Perfect.
Here. And then I would start my chest compressions here.
Perfect.
That's 30 compressions to 2 rescue breaths.
Perfect.
And I go to like 2 millimeter depths. Yes.
25, 26, 27, 28, 29, 30.
And then I put my back mask and I
perfect.
2 rescue breaths. Then I resume my CPR.
Perfect. Now let's demonstrate ambu bagging, advanced airway, not a bucket mask.
Okay, so to give ambu bagging, the first thing you must ensure is that this covers the nose and the mouth. You must ensure that this covers the tip of the nose like this, and then you do a CE covering. C here, and then the E, like this. And then you now do a head tilt and chin lift. And then you straighten your hand down your left hand. Don't worry, the patient is unconscious. And then you hold the head stable with your thigh, and then you give the breath. And then you must ensure you are watching for the rising of the chest as you are giving the breath.
Very nice, folks. Very good. So at the International Implant Institute, you get an array of information. Ghazi was so gracious to come in this morning. He will be teaching the mega code a little bit later this afternoon. In addition, we will have a tutorial on how to temporize an immediate implant chair side. So we want to show the students, dentists, that when they have an emergency and a patient comes in, tooth number 9 has been evulsed, we can place an implant because that would be when we have the most bone at the time of extraction or trauma. And then we would place the implant more palatally. We certainly can utilize a technique where we place the paralleling pin first, graft around the paralleling pin, pull the pin out, put your implant in. You will have achieved initial stability, and this implant could very well be temporized. We want to show the students that when you put on their healing abutments, their impression copings, they can place cement or resin around the coping and then temporize the implant chair side so that we don't have to take impressions, send it to the lab, and come back with a flipper 6 weeks later. So the students will get information this afternoon with regards to how to restore an implant. And then the beauty of being at the Greater Washington Oral and Maxillofacial Surgery office is that on the 5th day of the course, the students will get direct observation of live patient surgeries. So at that point, day 5, they'll see Dr. Ibrahim Haroon doing perhaps an internal sinus lift. They'll see Dr. Haroon placing an implant in an edentulous space. They'll be able to reference, oh yeah, we just figured out what's the motor setting for the implant? Or do we need to change the setting from when we're placing the osteotomy versus when we're going to be placing the implant? They'll be able to see the sequence of drill bits. They'll be able to see live patient surgeries. In addition, they will be able to see how are we going to place an IV. We're going to do an IV tutorial this afternoon. So International Implant Institute has more than meets the eye. We're not located in a hotel where you really don't get the action of an oral surgery office. We're not located in some kind of classroom or a conference room far away from intense energy of an oral surgery practice. Dr. Brennan, do you have any questions for us?
I do. How would you sign up for your course?
Absolutely. So I'm just showing you here. This is the crown that we placed last time. This is the crown, the temporary crown that goes on to the immediately placed implant, and it screws down in. Good question, Dr. Brennan. Thank you very much. So the folks all should be aware you can always find us, number one, pretty easy, extractionjackson.com will lead you to the International Implant Institute website. That's 2 words, extractionjackson.com. In addition, you can find us at INTL, period, IPLANT, period, INSTITUTE.com. That's International Implant Institute. And you would need to sign up, which would be to enroll. Sign up and enroll through the Institute. And then there is a small button that says pay. The courses for this 2024 is $2,000 for the 5-day hands-on course. We also are having a weekend of pearls of wisdom. Dr. Brennan liked my word, pearls of wisdom.
I like pearls. I like the idea of pearls. Yep.
Pearls, right? And what we're going to do is that one's going to be lecture and observation only. Eventually, we'll rotate into a weekend where it includes hands-on practicals. But for right now, we have an entire weekend, October 4th, 5th, and 6th, all day Friday, all day Saturday, half day Sunday. And you can find that also at INTL, period, IPLANT, period, INSTITUTE.com. Any other questions, Dr. Brennan?
Yes. So, and where are we going forward in the years to come? Give me a little insight to the vision so that everyone knows kind of what's to come this year, next year, and so on and so forth. Where are we going with the project?
Yes. So the vision is broad. The vision is grand. We start small and we think big. Number one, there will be a day when the dentists bring their assistants. We want the assistants to know what are the instruments that the implantologists are going to need at each step. Your assistant should know what are the instruments to expect when we can't place an implant. Okay, get your graft material. How do you prepare your graft material? The assistant should be very much involved with every step, and the dentist should be able to rely on their assistant. So one of these days, we'll have dentists present with assistants as well, so that we can do a two-team approach. Number two, one of these days, we should have some hygienists involved, because hygiene is very important. Nobody ever takes the hybrid off. Everyone's concerned whether or not if we remove it, are some of the implants going to get loose, or should we take it off, or should we just keep it on? So we want to have hygiene very much involved with how to keep and maintain all-on-4 hybrid prosthesis. In addition, sometimes folks say that the International Implant Institute is too small. I can touch the walls and I can touch the walls. So one of these days, maybe we may open up to a bigger, not auditorium, but just a little more space so that we're not so snug. Dr. Esther said the other day, she thought that it was very cozy. I said, that's a good way to put it. It's cozy, but we want to have a little more room to maneuver. In the future, we are also going to do hands-on live patient surgery. So for instance, I'm going to be going down to Cancun in October and checking out a clinic that's located in Cancun. I do intend to bring students to Cancun, to the clinic, so that we can place implants on live patients. You know, it's important that we're not just placing the implants, but that there has some follow-up, so that the patient then receives the prosthesis. So I will be going down to Cancun to meet and get to know the restorative dentist of the clinic and the clinic operator, so that when we come down in April 2024, when we do live patient surgery, we know that we're going to be handing these patients over to a responsible restorative dentist. So there's a lot in the future for International Implant Institute. Thank you for asking, Dr. Brennan. Any other questions?
Oh, that's a huge future. No, you always got to lay out where the vision's going. I mean, that's going to be a lot of fun, too, on top of all the fun learning, the exciting opportunity, and then also to be in a destination that, I mean, that would be great. For example, in New York, it's getting a little bit rainy out here. It's pretty cloudy. You guys had rain yesterday. We got that here today. So it'd be great to kind of come out of your comfort environment a little bit and go to a nice, beautiful beach and have a good time. I love that. It really lays out the scene to imagine what a course like this would be like. You know what I mean? So it's also a getaway destination.
Absolutely.
Yeah.
So that one is in April. But for those that are interested in learning a little bit before April, we have our next immediate 5-day course will be November 11th through the 15th. Here in Manassas, Virginia. We've made it so that strategically the Institute is located within the 15-minute proximity of 5 hotels, and we have transportation. So the students will go to the hotel and the transportation brings them all back. This morning, all the students jumped into our van driver, Giannis's van, and then he brings us to the Institute. We spend the entire day at the Institute, and then the van driver takes everyone back to the hotel. So he also takes us to DC, and he also takes us to the YM lab. In November 11 through 16, we will have our hands-on 5-day curriculum. We also have one in January, and we have one in February, and then we have one in April. I can give you the dates. They're also located on our website.
Excellent. Just so to summarize, we got November, we got January, February, and April for everyone listening that's interested into inquiring about some more information, so you can kind of look at dates ahead for what's to come in the next 6 to 9 months. Excellent. Excellent. That sounds pretty good.
Any international student, we will write a letter of invitation and contact the embassy on their behalf if they need any visa or any documentation so that they can participate in International Implant Institute. We're here to help.
Wonderful, wonderful. And I didn't give you a formal introduction, so I don't want to miss out on that. We kind of hopped right into it, and I love that. But I can't forget to give you your shout out. So Dr. Julia Jackson, oral maxillofacial surgeon, you didn't mention that before, of Virginia, right now in Annandale. Right now you're very close to Washington, D.C. One of the co-founders of the International Implant Institute from Temple University, as well as Howard, correct, right, for oral surgery?
Yes, 6 years of oral surgery training. 2 in New York, right where you are, and 4 in DC. Yes.
That's right. That's right. Speaker, key opinion leader. You can find her at Dr. Julia L. Jackson on LinkedIn, as well as Socket Grafting Girl on Instagram. Got to make sure we give you your praise. Look at what you're doing. Come on. This is not out of the ordinary. This is very excellent.
Thank you. It takes a team. Dr. Anarobi, as I mentioned, a prosthodontist. He goes all over Africa, Ghana, Nigeria, Kenya, Ethiopia. He starts implant study clubs. So we knew that the people were there who wanted to learn. And the other, there's 3 of us. And the third person is Dr. Ibrahim Haroon. Dr. Haroon and I started in oral surgery. He joined my practice in 2016, and we were working hard and we were all in the grind. And then he'd say, why don't we start our own practice? And I say, no, I don't want to start my own practice. He said, yes, you got to start your own practice. So I think it was maybe about 2021, Dr. Haroon left our practice. And since then, he has started 3 or 4 different oral surgery offices. And this one, Manassas, is the home base for International Implant Institute. So Dr. Haroon provides the facility. Dr. Anarobi provides the students and the energy and the enthusiasm. And I just try to put it all together and make sure that it runs smoothly, and am encouraging people to join us. And thank you, Brennan, for reaching out to me. I saw you last week in Orlando. You and I are both oral and maxillofacial surgeons, and we went to the AMIS conference, which was so exciting, so much cutting edge information. And I was just glad that you gave me a few minutes to introduce myself. So thank you, Brennan. I'm very proud of you.
Of course, and thank you. Thank you. 9 months, and then got to get that certificate. I don't want to count eggs before they hatch, but thank you. I appreciate that too as well.
Absolutely.
All right, everyone. Got to get back to it. I want to let you guys get back to it too. Nice to meet you all. And Dr. Jackson, we'll talk soon.
Okay, thank you, Brennan.
Thank you.
And turn it
all right.
Turn it so you can see praise.